Hi, everyone. How are you? My name is Brittany Roberts. I am a team lead with the operations team for our Georgia market. Today, I'm going to go over some claims information, just give you a general overview of some claims information. The first thing I'm going to go over is general claim submission information. Timely filing is 180 days from the date of service or the date of discharge. This does include original and corrected claims, meaning if you have some additional information that you need to correct on your claim, you do need to do that within 180 days of the date of service or discharge. We do accept paper and electronic claims. Of course, we do encourage electronic claims. We want to make sure that you all are getting your claims processed faster. You get paid faster if you submit electronically, and then it reduce the administrative costs both for us as the CMO and you all as the providers also. We do have some information in our provider manual regarding claim submission. So if you have any questions, you all can visit caresource.com under the providers tab, and you can pull up our provider manual if you have any additional questions for claim submission. And we do have 3 separate forms of payment. We do electronic payments through EchoHealth. You can receive a virtual check card through Quick Remit, or you can receive a paper check. Again, we do encourage that you all receive electronic payments to ensure that you're getting your payments as fast as possible. And we do use the clearinghouse Availity, and you can sign up through www.availity.com to sign up with Availity for electronic submission. This slide is just some general claims errors that we see, some reminders that we want to give you, just to give you some insight to allow you to get your payment as fast as possible and for your claim to process as swiftly as possible. For newborn claims, you want to make sure that you all are using the newborn's CareSource ID and not the mom's CareSource ID. In addition to that, you want to make sure that you are remaining within the timely filing guidelines when you're submitting your newborn claims, and also making sure that you're including the birth weight of the newborn on those claims. Continuity of care on the professional side. You want to make sure that you all are submitting the admission date on your professional claim form. That way we can avoid errors, denials and errors for member not being covered. If that admission date is on your professional claim, then we will acknowledge that the member was in an inpatient setting prior to their termination with CareSource. Consent form is a big one. You want to make sure for the claims that require a consent form that you are submitting the consent form with your claim. The type things that we notice that are missing on consent forms are the signature, whether that be the members or the providers, the date of the signature, or an incomplete physician statement. So you want to make sure that you are submitting a complete consent form with your claim. That way we avoid any denials and that you can get your payment as fast as possible. Last thing is itemized bill. CareSource has a two-step process for outlier payments. If you are looking for an outlier payment, you do have to submit your itemized bill. In order to lessen that payment claim timeframe, you can submit your itemized bill when you initially submit that claim. In that process, we would still pay you in 2 payments. You would still receive your inlier payment first. However, if we get that itemized bill with that initial claim, then we will automatically send the information over to the appropriate team so that you can get your outlier payment as soon as possible also. Next, I'm going to move on to just some general information regarding coordination of benefits. With coordination of benefits, we wanted to call out that timely filing does apply. So you want to make sure that you're aware of the timely filing guidelines for coordination of benefits. CareSource will pay secondary if we are the secondary payer, and you do need to receive your payment from the primary carrier prior to submitting your claims to CareSource. Any balance after receiving payment from the primary payer, CareSource will cover as long as it's in the Medicaid's guidelines. And the claim information is important when you are submitting your COB claims. You want to make sure that you are submitting that EOB from the primary payer. And you want to also make sure that all of the services that were on that claim to the primary payer match the services that you are submitting to CareSource. Again, that will just ensure that you're not receiving any denials and that you are getting your payments as fast as possible. Regular timely filing guidelines do apply to CLB unless there may be a situation where you received a payment from the primary payer after timely filing. In that situation, you want to make sure that you are submitting your CLB claims within 1 year of the EOB from the primary payer. This slide is going to just we're going to go over the difference between claims disputes and claims appeals. Disputes are if you have received a payment, however you received the payment and you think it's an error. And an appeal, this is non-clinical, is if you have not received a payment, meaning that you believe the denial is an error. A dispute must be received in writing within 3 days of the date of payment, and an appeal must be received within 30 days of the date of payment. Each of them will require the sufficient information to identify the claim. You'll want to provide a written statement on why you believe the claim should be adjusted. And you will also want to provide any supporting documentation or medical information that will help us within our decision. Disputes will have their decisions made within 15 days of receipt. Appeals will have their decisions made within 30 days of receipt. And any untimely submissions will be subject to being upheld for a dispute or dismissed for an appeal. You can submit disputes and appeals via our provider portal, our fax number, and also via mail at the PO Box 2008 in Dayton. Again, we do encourage that you submit that information via the portal. Submitting electronically does allow the process to flow much smoother and also decisions to be made much faster. And just a reminder, if you have submitted an original claim and you need to make a correction on that claim, you just want to submit a corrected claim. You do not need to just submit a dispute or an appeal in that situation. But again, you want to make sure that you're submitting that corrected claim timely if that's something that needs to be done. Next, we're going to just go through some claim trends from 2023. We're going to give you some information. CareSource processed a total of 4.9 million Medicaid claims in 2023. Out of those 4.9 million claims, 99% of those claims processed within 6 days. We do have a first pass accuracy rate denied. We do have a first pass accuracy rate of 100% on those. And the top three denial reasons we saw on those were COV, information again, not received. disallowed, which just means that either an authorization was not received on a service that required authorization, or an authorization was received, however, the units on the claim exceeded the units on the authorization. And the last thing is an exact duplicate, which is just means that we had already received another claim for the exact same services, and that claim had already processed through our systems. And this information is as of 2/24, 2/22 of 24. So again, you just want to make sure when you are submitting your claim, you're submitting with everything that you need to avoid those denials and ensuring that you will get paid timely. And this last slide that I have, it's just some information, some facts that show our operational excellence. We are leading the nation in claims auto adjudication rate at 98%. We have over 99% of our claims pass and a first class claim accuracy, and we have 100% prompt payment. Less than 1% of original claims require adjustment. And then our claims payment rate, our average to pay is 13 days, and our average days, and then 99% of our claims process within 6 days of receipt. So that just goes to show that we do have a proven track record for worry-free operations. That is all I have for you. I'm going to pass it off to Trey, who's going to talk about provider engagement.
Good afternoon, everyone. My name is Trey Lawrence. I'm one of the managers over the health partner teams with CareSource, and I'll be discussing provider engagement with you all today. First, we're going to discuss provider credentialing, contracting, and provider enrollment. Provider credentialing, you'll credential your providers through the GAMIS portal. GAMIS has the CVO, the Credentialing Verification Organization, which you'll credential your providers through. Once your providers are fully credentialed and you receive your credentialing information back from Georgia Medicaid, you will then proceed and move forward with actually being able to contract with CareSource by visiting www.caresource.com. On the side of the screen there, you'll notice a big purple circle, not a provider, become an in-network provider, become a CareSource provider. From there, that'll take you to our online contracting application. Our online contracting application is quick and simple, takes less than 5 minutes to complete. Once you submit it, I can't stress this enough, but you will, once you complete the online contracting application, you will receive an email. And in that, and it's critical that you electronically sign this email, because you cannot complete the online contracting application without electronically signing the agreement. Once you electronically sign, it'll go over to our online contracting application team for review and processing. Once processed, it'll be queued over to our provider information management department. They will then proceed with loading your providers. And I want to put extra emphasis here as well. It is so critical that you always keep your information up to date with Georgia Medicaid, because we do follow the Georgia Medicaid provider auto load simplification process, where we auto load your information using the Georgia Medicaid credentialing file, also known as the 7400 file. Once we load your provider data into our system, you'll receive a welcome letter from CareSource with your CareSource provider ID number and your effective date. This slide here touches on our provider team and locations. Our health partners, we have them strategically placed all across the state. As Our member rewards program, we incentivize members of all ages for going to their doctor. This helps decrease no-show rates in provider offices by encouraging members to go there to their doctor. And our emergency support for hospitals. Rural hospitals face financial hardships through these hard economic times. This may cause rural hospitals to limit or no longer provide services to our communities. CareSource helps with this by providing emergency financial support. Our commitment to the Fostering Success Act, CareSource invested $1 million to help improve the lives of those transitioning out of foster care. And also our Tiny Home Community Initiative, CareSource invested another $50,000 towards building tiny homes to help provide some stability for kids exiting the foster care program. And our partnership with the American Heart Association, we donated over $300,000 to support a produce prescription program, a health education campaign, and an AED program for community and faith-based organizations. Our 2024 value-based reimbursement participation, CareSource has contracted over 4,000 providers to participate in our value-based reimbursement program this year. Our health partners host monthly meetings with our providers who participate in our value-based reimbursement program to review their quality performance and to strategize to come up with ways on how to improve their quality. This also includes looping in our care managers and nurses, so that way we can help address the whole member's health. Incentives are available to include the whole member's health, from effectiveness of care, utilization, access availability to care, and care coordination. Our value-based care incentives, we more than doubled the number of contracted provider groups in our value-based reimbursement program for 2023. Also in 2023, 100% of contracted provider groups were paid incentive dollars based on our 2022 VBR program. And we also saw over a 10% increase in at least 5 DCH focus measures. Our provider tools and resources, again, if you go out to www.caresource.com, hover over the provider icon there, you'll see the drop-down menu. You'll see a whole range of different tools and resources at your disposal. Everything ranging from our drug formulary to our provider manual, our quick reference guide, provider policies, and also please go out and check out our updates and announcements page. You'll see policy updates related to the CareSource and also too with our vendors. And while you're at it, check out our prior auth page. We have a prior auth lookup tool where all you have to do is punch in the CPT code and it'll tell you whether or not a prior authorization is required. Also, if you look at the right-hand side of my screen, you'll notice that by visiting our website, you can gain access to our the CareSource provider portal. There, you'll find a whole variety of different features, really neat features that'll help you through conduct business with CareSource. Everything ranging from checking member eligibility to submitting claims to checking COB status and submitting COBs, submitting prior authorizations, submitting disputes and appeals. And also for our primary care providers, we have the clinical practice registry that'll help identify care gaps amongst your CareSource members to assist you with getting them closed. I want to make a quick acknowledgement that CareSource would not be as strong as we are without our great provider network. You all work so hard day in and day out, living up to the CareSource motto, which is to provide healthcare with heart. We strive to simplify and reduce the administrative burden so you all can provide the highest quality of care to our members. We always look forward to your feedback and partnership within our provider community to help us continue to live our motto, which is to provide healthcare with heart. I want to thank you all for your time today and thank you all for the great work you do for our members. And now I'll pass it over to my colleague, Stacy. Thank you all.
Hello, good afternoon. I'm Stacy Reynolds, and I am the Georgia Medicaid Manager for Utilization Management for CareSource. We're going to talk this afternoon about the prior authorization process. The prior authorization process starts with you, the provider, sending us a request for prior authorization. That request can come in through GAMIS, which is the preferred method, or you can fax it, or you can go to caresource.com and submit it through our provider portal. The next step is that your request is reviewed by a clinical care reviewer. That clinical care reviewer is a nurse or a medical director licensed within the state of Georgia who is experienced, educated, and trained to review your request for prior authorization. And we have standardized tools that we use for those requests that we receive. They are evidence-based practice tools that we go by and review them for medical necessity. And then we notify the decision back to the provider. Something that's specialized within CareSource is our utilization management teams. And these are not silos, but overlapping teams that are specialized within the fields you see here on the screen. These individuals are trained and speak your language, the language of the provider, to be able to know how to communicate with each of you to meet the needs for our members, your patients. Part of our prioritization within the utilization management department is to decrease provider burden, as Trey mentioned earlier, and part of that includes reduction of the need for prior authorization to come from the provider. We have an active goal within our utilization management program to reduce our prior authorization tool requirements that will be worked throughout 2024 to reduce the number of codes that we require for prior authorization. On this list, you'll see that we have a specialized behavioral health team, and that behavioral health team has prior authorizations that are based on the level of care. And you can see on this table, if a PA is required, how to submit that PA to best serve your patients. You can submit the PA through our CareSource provider portal, through GAMIS, or by fax, and any method is approved. However, these will get you the quickest response if you use the actual submission PA shown on this screen. I'd like to remind you that we have 2 tables set up in the room. You can look for our purple, and we invite you to go visit our tables and speak with our CareSource representatives to receive more information and have any questions answered. And I'll turn it back over to Adam.
Thanks, Stacy. Thank you, Stacy. Well, that concludes our presentation for CareSource. Again, thank you everybody for coming out today, and we're ready to field some questions from the audience. I think we have one here from Rose Center, maybe.
Okay, so I guess I have like two-part questions.
Sure.
For the COBs, when we're doing the eligibility, sometimes it says that they have a COB, and so we check with the patient while they're there to see if they still have that insurance. And a lot of times the patient says they do not. So my question is, are we able to go on the website and get it changed, or does the patient have to call you guys and get it changed?
Our COB information, we use GAMIS as our source of truth. So we should be following what's on the GAMIS website regarding the members' eligibility. If you're noticing a discrepancy, then you would definitely want to reach out to let us know. If you have anything with you today that you need help with, you can come see us at the claims table, and then I'll be happy to look at it with you and help you with it.
Okay. And then the second question is, because we're FQHC, I noticed, we noticed the person that works our claims says we're getting a lot of our claims that are saying non-contracted fees. And I know on our claims we put certain codes on there for reporting, but it's becoming where it's not just the reporting codes, but it's some of the office visit codes. So do we just contact our provider representative in regards to that if we're having so many issues?
I'm sorry. If you have claims issues, yes, you can contact your provider rep, especially if it's multiple and you want to put together a sheet or something to send through your provider rep. You can do it that way, or you can contact our call centers. And then again, if you have them with you today, if you want to meet me at the claims table, then I can look at it with you and we'll figure out what's going on.
Okay, thank you.
Other questions? I would just say thank you again. Appreciate everybody's time and thanks for all you do for the community and our members.